So thank you all so much for having me today. Where I thought I might start. So I've been working exclusively in healthcare for about 10 years now. And prior to that was in consulting, and a lot of my clients were healthcare clients. And so sort of over 20 years, I've been studying the industry. And when I talk to people, what's going on in the system, what I hear over and over and over is that the healthcare system is broken in the US. And I'm sort of interested, well, what's broken about it? Why is it broken? And I hear a number of things. I've heard a number of things over and over. It's the providers, physicians, health systems. They're clueless. Sometimes I hear they're greedy. Then it's the payers, the insurers, the health plans. They're even greedier. And then it's the product manufacturers, pharma and device manufacturers. They're the greediest of the crew. And then the last is the patients, the consumers. And often I hear some of the nastiest things said about that group. That it's the patients, they're the biggest reason the system is broken or that's failing. That as consumers, we're all stupid or lazy or both, and if only we started doing the right things or stopped doing the wrong things, everything would be better. We'd be having better outcomes. We'd have lower costs, or at least sort of a better trend. And I heard that for years. And quite frankly, I believed it. There were so many people who were saying it, and many of those people were important and smart and had lots of degrees from great universities. I believed them. And then one day I woke up and said, that just doesn't seem to be the issue. It doesn't seem to sort of describe what's really going on. What if we all thought about it a little differently? What if we said, actually, no, the system's not broken? What if we said, and looked at it and said, no, the system's actually working perfectly. It's actually working perfectly based on what it was designed to do. What if the flaw in the system is that we've been using the wrong design principles to create solutions to address the healthcare needs in the US? So it led me down a path. What is the design paradigm that we use in the US to design all things for healthcare? What I believe it is, or what I've seen it to be, is what I call the balanced interest paradigm. And it goes something like this, that there are a number of interest groups. There are payers, there are providers, there are the product manufacturers, the patients. And that if you want to create truly effective solutions in healthcare, you have to make sure you're addressing the needs and concerns of every one of those groups. And that you have to ensure that the interests of every one of those groups is aligned. And when you do that, you will deliver successful solutions. So here's what I'm here to tell you today. If you're designing based off those principles, you're wrong. That the design principle we should be using is a very simple one. That there is only one group that matters, and that is the consumer. And if you're a provider or payer, product manufacturer, your job is to serve the interests of that consumer. And if we started designing around a consumer-centered approach, a truly consumer-centered approach, that I believe we would have significantly better outcomes, significantly lower cost. And so what I wanted to share with you today, that is the approach that I'm taking, that Wal-Mart is taking, which is what would a system look like that was truly consumer-centered, and what would you go do if that was your design approach? And I'll focus on four things, and I certainly don't think these are the four things, but these are just sort of examples of four things that would happen in a consumer-centered environment, design environment for healthcare. And there are certainly more, but these are the four that I like to kind of focus in on. So the first is, if we were truly consumer-centered, the primary care physician and the primary care physician's office in the hospital would not be the center for healthcare. We'd be introducing new and innovative service delivery models to address consumer needs that were designed around the needs of the consumer. And we'd actually be leaning into different professionals and new types of professionals to address the consumer need. And I'll spend a little time on this one. So let me talk to you about the health service delivery innovation component. And let's talk about another industry, and people get very uncomfortable. I've used this example a lot, and I just continue to use it because I've realized it makes people so wildly uncomfortable that I just like it and I keep doing it. And that's comparing humans to cars. So I'm going to use the auto industry. So let me give you a couple facts. In the early 80s, the average vehicle in the US was only staying on the road right around 6 years. Today, that number is almost double. And the real question is, well, why? Why is the average vehicle able to stay on the road longer today than it was 35, 40 years ago? Is it because cars are made much differently? No, cars still have, every car you drive has 4 tires and an axle and has an engine, has doors and has windows, and it basically is the same. They've made incremental changes. If you actually ask the industry, there are 2 things that have driven allowed vehicles to last longer. One is the introduction of sensoring technology in the cars, where those cars are where the monitoring of those cars real time is enabling you to know if there's an issue in the vehicle and address problems earlier than later. So that's one. But actually, if you really dig down deep and ask the experts, what they'll tell you it relates to service delivery innovation related to the care for cars. And in the early 80s, if you wanted to take care of your car, effectively your option was to do it yourself, change your own oil, fix stuff on it, and you'd best be an expert. And most of us, I'm certainly not an expert, I would assume many of you aren't car experts as well. Or your other option was go to a mechanic. And so what was the experience of trying to schedule an appointment with a mechanic in the early 80s? You had to call them, you had to get an appointment, you didn't necessarily get it that same day. When you did get it, you didn't actually know how much it was going to cost for them to do whatever you needed. Even if it was just an oil change, you didn't really know how much it was going to cost. And so you were a little kind of scared. It sounds kind of strangely a lot like healthcare for consumers in the US. But then what happened? The emergence of groups like Jiffy Lube, Valvoline, Tire and Lube Express fundamentally changed how people cared for their cars. You can go in and get an oil change real time at a fixed price. You can do it pretty quickly. You can do it 7 days a week. By the way, they're giving you advanced diagnostics on the back end. It's not just an oil change or a tire rotation. They're giving you 30 or 40 things that they're checking. And they're telling you, hey, you've got these issues, and if you need to go do something about it, or making recommendations about what we should do. And so I think we see the same sort of challenge. Why are we not innovating in the same way we have in almost every other industry, including auto care? Why have we not seen service delivery innovation here in the US? And the good news, we are starting to see it. I think certainly what you do, when you think about the ability to bring services to a consumer's home and home-based care in general, and the ability to bring more of that environment for care to the consumer's home or where they are, in their home, in their school, at church, where they work, that has an enormous opportunity. We've seen an example that I like to use is a kind of simple one, but it was a group that we've been working with using dental care and oral care as a basis to address broader kind of healthcare needs. And so they've taken what was a kind of typical dental practice, actually focuses much more on preventative care, but they added in a layer, which is when people come in, they're actually doing kind of basic health assessments, just for free. Biometrics, BMI, a few other things, blood pressure. They're asking some questions, giving an individual, while they're there for a dental visit, some additional healthcare information. What they're finding is it's changing the consumer journey around how they consume healthcare. And so we're starting to see some innovation and some opportunities, but we think there's a need for more. The last kind of point on this I'll make is we're also seeing the need to either elevate existing professionals to play a greater role, particularly nurses, to how can we have nurses do more, work to the upper third of their licensure, professional capabilities, actually expand that to do more than they're allowed to do today. But we also think there's an enormous need to start to introduce new types of providers. It's what we affectionately call PNPs, professionally nice people. These aren't clinicians, these are individuals whose job it is to support the care of consumers. And you're seeing it in some instances, certainly in the developing world, and some places here in the U.S. with the community health worker model. I'm involved with one in the Navajo reservation with a group called COPE in New Mexico that's showing wildly better results in terms of supporting individuals with chronic disease than in almost any other market that I have seen. And so we think, there's an enormous opportunity to kind of rethink both innovation around service delivery and the provider type. The second thing, where there's in a consumer-centered environment that I think we'd see change is there are these services or offerings that are currently locked up or hidden behind the existing system that if we could free them up and get them directly to the consumer, it would accrue enormous benefit. And the goal there being we try to start to trust consumers to really manage their own health. And the example I'll use is labs and diagnostics. It's hard, I've been going through it, it's hard to actually get a cholesterol test around the U.S. It's hard. You have to schedule an appointment with a doctor for the most part, and it takes a lot of time. But here's what we know. Labs and diagnostics, 3% of the spend, but they account for 70% of the diagnosis that occurs in the system. And so I would challenge you to say, if it's that valuable and that, frankly, cheap, why aren't we making it ubiquitous? Why have we made it so hard? Why is it that if I'm a father or mother of a child and then I want to just figure out if my kid has flu, that I have to actually take them to a doctor's office to figure that out? Why isn't there an over-the-counter flu test? Why isn't there an easily accessible cholesterol test that allow people who are actually motivated to engage with their health to do so? And actually, I'll share with you real quickly some information about an event that we've sort of put on over the last couple of years. We do it under the banner called Wal-Mart Wellness Day. And it's basically a free screening event to consumers. We do it every couple months on a Saturday for 4 hours across every store that we have, all 5,000 that we have. And in those 4 hours, we typically will do about 300,000 health screenings. And those are, blood pressure, we'll do cholesterol, glucose. And what is really interesting is about 70% of those individuals haven't had a blood pressure run in the last 3 years, maybe in many cases have never had a cholesterol test. And we're actually, those events are identifying individuals who have health risks, who have high cholesterol, who are hypertensive. But what's really interesting is what we're seeing those consumers do with that information. They're not just coming in and getting a cholesterol test home, finding that it was high and they're actually going and doing something with it. They're actually empowered. And so this idea of unlocking some of these services that are actually hard to access and giving them more directly to consumers so that they can become empowered and engaged, we think is an enormous opportunity. The third thing I'd highlight is that in a consumer-centered and designed environment, digital health would explode and would not be impeded by regulations or state medical boards. And what I mean by digital health, I don't mean telehealth. I don't mean connecting a consumer to a physician or a provider. I mean using technology in lieu of a provider to address some or all of the health care needs that a consumer has. And you're seeing enormous innovation in the space from an artificial intelligence perspective, companies like Virtuwell with Health Partners or Zipnosis or Lemonade that are showing phenomenal promise. And the idea being that you can reduce barriers, make care wildly accessible, wildly scalable at a much lower cost. We believe that doing that actually enables much more consumer engagement with health. And I'll use a quick example that in our own stores, there's a company called Pursuant Health. Pursuant manages or has created these kiosks that are standalone health risk assessment kiosks. So they can do blood pressure, BMI, ask a bunch of questions. You can get a basic health assessment done. And right now those kiosks are only in about half of our stores. So it's been about halfway through the rollout. But here's an interesting fact for you. Over the course of 7 days, so over the course of a week, even though Pursuant kiosks are only in half our stores, on those kiosks, they're doing more health risk assessments than the traditional healthcare system is doing in that same week. So if your goal is to actually engage individuals in their health in a scalable way, digital health is one of those solutions. And then the fourth area that I'd highlight is this concept of using, or not just focusing on traditional healthcare data, but using non-traditional healthcare data about consumers to actually drive more advanced consumer health analytics. And I'll sort of explain what I mean. Using your behavioral and consumption data that exists, what you're doing on social media, what you're searching for on Google, what you're buying in a Wal-Mart or a Target or a Costco or Kroger, using that data that you produce every day, instead of constantly asking you as a consumer to produce more, come in and get this test run, come in and get this blood pressure run. How do we actually start to use the data that we already have about you that you create all the time to actually help you assess and predict your health or predict health events? The reality is, as a diabetic, when a diabetic gets diagnosed with diabetes, they take their A1C and a physician reads that and says, yes, you're clinically diabetic. If you actually look at the literature, what it would say is that individual didn't become diabetic that day that they got that A1C read. They actually became clinically diabetic, likely somewhere between 3 and 5 years earlier. And the basis for almost, if you look at all the diagnostics that occur of chronic illness, most of them are coming through acute events, so completely unrelated events. So the challenge is, how can we use other data maybe to identify earlier where these risks exist? And it's already happening. You may remember a few years ago, they got in a little trouble on this around the marketing side of it, but the underlying analytics you can't sort of challenge, target. They, in assessing their data about consumption behaviors and changes in consumption behaviors, they could identify women who were pregnant. And it wasn't out of obvious stuff. It wasn't, hey, this woman bought a pregnancy test. And so they started in the data saying, now we have identified women who are pregnant, and in most cases, those women didn't even know they were pregnant. More recently, Microsoft, last summer, published, based on research they've done, changes in your search behavior are potential indicators of the onset of cancer. So what you're searching for, how you're searching changes in the tone and tenor of the words you use, the time that you search. That is a marker for onset of things like pancreatic cancer. And so we think there's an enormous opportunity to use this behavioral data, not claims data, not clinical EMR data, which there is really not that much of compared to the behavioral data that we all produce every day. Using what we produce every day to actually create value from a consumer perspective. So those are 4 areas that if we were truly doing consumer-centered approaches, that we think you'd see change. And what I want to close on is that I believe that a consumer-centered approach actually drives better quality. And I'll give you, and I think that's critical to understand that. So I'll give you 2 quick examples. One is around sleep health. So Americans are sort of challenged around sleep, and certainly there's a lot of Americans who are walking around with undiagnosed sleep illnesses. So the question is, how do we improve access to sleep testing? Well, in the U.S., 95% of sleep testing occurs in the hospital or in a sleep center. 5% occurs at home. But that indicates that 95% is actually appropriate in the home. And what we know is the cost of home testing is 1/5 the cost of the facility testing. So why are we doing it that way? Because what you hear from providers is, I just don't have as much control over it if it happens at home. Okay. And our goal is to try to get more people who have sleep risk to get assessed. The second one actually is very personal. My wife helped found a company a number of years ago called Baby & Company, and they now operate a significant number of standalone labor and delivery maternity centers across the U.S. And in one of those locations, there's a hospital that's very near. And so I had this data point shared with me. The C-section rate in their facility is around 5%. The C-section rate in this hospital, that's half a mile away, was 40%. So I asked why. And what I was told was, well, different risks. Higher risk patients are coming to the hospital. We said, great, but I've got really good analytics people. We can control for that, and we did. And when you controlled for it, it still put the C-section rate in that hospital, controlling for risks or differences in risk, of the patient at about 35%. So I said, again, why the difference? Here's what they said. It's what customers want. The patients are saying, hey, I want a convenient labor experience, I'd like to just schedule it, do it. I said, okay, great. Except I actually know who those customers are, and I can go ask them. So we did. So we asked women who had C-sections, controlling for those, removing those who truly had an event that demanded clinically a C-section. We said, for those of you who it wasn't demanded, why did you do this? And here's what we heard, 6% of the time. I had my C-section. I did a C-section because I did what the doctor told me to do. I was just following directions. Okay, what I can tell you right now, C-section cost 3x, 4x, what a normal delivery would be. Significant risk to the mother, significant risk to the baby. Again, a consumer-centered approach wouldn't allow for that. And so my challenge in closing to you today is I hope all of you are truly attempting to build solutions that address healthcare needs in the U.S. And my challenge is, as you're doing that build, and as you are coming to solutions, that you will, whether it's in the middle or the end or at some point, take a step back and do this. There's this famous kind of Wal-Mart cheer. It's actually at times a little bit annoying. We do them often at the beginning of meetings, at the end of meetings. Sometimes it's obnoxious. We do them in the middle. And I'm not going to make you all do the cheer today. So you're safe. Particularly, I didn't want to make you stand up and do this. But so there's a call out in the middle of it that the person who's leading it says, who's number one? And the response from the crowd is, the customer always, okay? So my challenge to you is, as you're building solutions, as you sort of put that solution forward, ask yourself, as I built a solution, who was number one? And if you can't honestly say the customer always, then go back to the drawing board. So with that, thank you very much.